Obesity in adolescents is associated with a range of cardiovascular and other health issues. Now a new study adds one more: hearing loss. We've reported in the past on several studies linking obesity with hearing loss in adults, but now researchers have found the same association in teenagers. As reported in a recent medical journal, the reason for the connection is not known. The scientists suggest that inflammation induced by obesity may be a factor in organ damage. The audiology specialists at Lake, Ear, Nose, and Throat explain how hearing loss in youth often presents.
For children to have hearing loss, the earlier we find out, the better it is, because it's a part of them. And it's not something new that they have to get used to. It's not something that all of a sudden they're made fun of. When we find a child that's in their early teens that has hearing loss, then they feel a little devastated. They're embarrassed. Something's wrong with them. They don't want people to know they have hearing aids, and a lot of times they will not wear them. And so we have to look at other means of trying to help them in the classroom, and we work with the school systems on educating them as to how they should amplify the classrooms for that child to do better. We test children of any age, and most of them pass their hearing screenings with no problems. If a child has hearing loss, then it could be a temporary condition that can be corrected through surgical procedures. Maybe they need to have tubes placed in their ears, and that usually can correct that, and then they're hearing fine and everything is going to work well for them when they go to school. For children who have more of a permanent hearing loss due to birth or some other illness that they may have had, then we will start talking to the parents about how we want to rehabilitate that by use of hearing aids, working with the school systems to make sure that there are speakers set up in the classroom so that the child can hear the teacher and not have distracting noises. Most of the time when a child has hearing loss that's associated with ear infections, it can be easily corrected. We see children that have tubes. We see children that sometimes have to have 3 or 4 sets of tubes. Occasionally there might be some scar tissue from years and years of infection that goes untreated and really neglected, and then we can see a mild hearing loss that again can easily overcome through amplification.
For appointments and more information about the hearing aid and audiology services offered at Lake, Ear, Nose, Throat, and Facial Plastic Surgery's 3 Lake County offices, click the Hearing Loss Story link on our homepage, yourhometownhealth.com.